what we are doing at Sirica is a very different, it's a very unique way of providing therapy for autistic individuals. And I'm going to call this talk Movement is Therapy. That is the bottom line. And I'm going to talk a little bit about the science behind it and why we are doing what we are doing here. So, our mission is to improve the quality of life of those affected by autism. And when you think about it, okay, who are the people affected by autism? Of course, the individuals themselves who are autistic, but also their family, their parents, their brothers, sisters, and their therapists, their coaches, their teachers in schools and in classes, their colleagues, their the therapists and doctors, and everybody is affected because wherever they go, it can be challenging if they're not having a good day. And so we said, let's attack this problem and figure out a way to help individuals with these challenges. And so if we improve the functioning of autistic individuals, it will improve the quality of life for everybody that is affected by this challenge. So what does the research show? There has been a lot of research, and most of it in the last 5-6 years, where movement-based interventions have been shown to improve the core challenges related to autism. And I'll go a little bit further on that. And so I've noticed, when Siri was growing up, she was diagnosed when she was 3, and she had a very challenging school years, mainly because she's non-speaking, and then that has its own challenges, but also that'll turn into behavior, and then inability to study, to be in the class, to be able to participate in normal activities that we all take it for granted. But she did an amazing turn when we introduced exercise. And my wife found this place where there were these amazing coaches that are trained specifically for to coach autistic individuals. And we saw a dramatic difference in her behavior, in her regulation, in her appetite, and all of those things. We were so surprised at the results that we were able to wean her off of all medications, and she did great. And thanks to my wife, Swati is right here. She's the one who drove her every day 50 minutes one way, to the East Bay to get her into this program. And in the meantime, while I was looking at, what are the innovations that can help autistic individuals, I found this company that was developing this technology for stroke rehabilitation. And when we talk about stroke rehabilitation, there are some similarities which I found that where the treatment was very effective in individuals with stroke and how they recovered a lot of their lost abilities. And so I said, oh, what if we introduce this to autistic individuals? And so that was my quest that 4 years ago, and now it culminated in having this center.
Okay.
Is everything good? All right. So how do you activate the brain so that it can build and repair itself? So what we found, or what the research found, is that number one, there has to be cognitive engagement. So there has to be a challenging task. So motor exercise, just going to the gym, will not work because they need to get involved. They need to get engaged in the activity. So it has to be interesting, obviously, and it has to be challenging. The second part is sensory integration. So you have to control all the sensory input that is going into that individual's brain, of course. And then there has to be a challenging motor activity where they're learning new motor skills. And so if you put all these three together, and that's our hypothesis, is that you can activate the brain, when you put this into a deeply immersive activity. And that's what can enhance neuroplasticity. And so we found machines from all over the world, and which machines can actually engage all these three areas. So it has to be cognitively challenging. It has to have something fun, obviously. And then, the sensory input has to be controlled. And then the motor output has to be gross motor output, not fine motor, because that can be another challenge for autistic individuals. And if you put these people into that situation, you can enhance neuroplasticity. And that's our hypothesis. And so these are some of the machines that we can show you after this after this conference, after this meeting. And so we are calling this cosmotherapy, cognitive sensory motor therapy. So the cognitive part is actually a video game using virtual reality. And so you are actually inside the game, you become a character and you are playing that game. The sensory input, again, is the visuals and the sounds, and then the way your body moves, it can recognize how your position is, the kinesthetic sense. And then there are other sensory areas that we can involve in this, but those are the basic ones. And then the motor challenge is where you use your large muscle groups. And so usually the trunk, your lower extremities, and maybe the shoulders a little bit. So, and that's what we want to introduce and develop this therapy. And so we did our own research when we had this machine from a company. So we recruited 9 autistic individuals, and we did a session with them on the machine. And you must have seen it on the website. There's a video of it. Number one question is, can autistic individuals tolerate VR? Will they keep the VR glasses on? That's a challenge, right? If they freak out or if they have difficulty focusing. That was not a problem at all. We found in these 9 individuals. And then these 9 individuals were representing the full spectrum of autism. We have the high functioning and the low functioning, we call our high needs individuals. But there's no problem with VR at all. No adverse effects. We were thinking, oh, what if they get motion sickness? What if they start throwing up or having seizures? That's a worry of a lot of these parents. So none of that happened. And then the third question was, can these individuals learn how to play or how to use the machine? That was not a problem at all. Within 2 to 3 minutes, every one of them figured out what they should be doing on the machine. Because when they have earphones and when they have VR goggles, it's hard to teach them what to do, right? And then all of them thoroughly enjoyed the experience. And this is like, average was 24 minutes. Max was 30 minutes. But they all loved it and they all wanted to come back for more. They gave us a score of 9.3 out of 10, a max of 10, on how much fun it was to use this machine. So what are the expected benefits? What does the research show about these kind of interventions? Well, number one is mood enhancement. As you know, any kind of gaming activity where you are winning or you're doing something, your mood elevates. So anxiety, depression gets better. Sleep optimization, because they're exercising, their sleep gets better, and a lot of autistic individuals have sleep challenges. The behavior regulation, for some reason, after these sessions, they become very calm, very regulated. So we expect that the aggressive behaviors will calm down. And then social skill building. Because this is a video game, we can have other individuals play with them and so interact on VR in the game. And overall, we think this will improve the quality of life, and that's our focus. Our focus is improving the quality of life. And if you can imagine, these are very high need individuals. A lot of them could be non-speaking individuals because they don't have many options as far as therapy is concerned. As you get older, and we expect that anybody 8+ should be able to use these machines. And once they become adults, there's nothing out there other than daycare programs. So here are the references in case you're interested. And then we're opening soon, so you can go to the QR code and say, I want to try the machine. So we have a wait list, and we expect that we can sign up people and have them try. It's a free session, so if you have a child or adult that you think might be interested in this, in trying this out, we will have a list and we'll set up appointments. So I will stop there. Any questions so far? Yes.
Have you tried to reach out to regional centers and sign up for to be a vendor provider? Because I think a lot of individuals would be.
Yes. Yeah, we definitely have plans for that. But right now, what we are looking at is people who are on self-determination program. Obviously, this is not an inexpensive endeavor, but people who are on self-determination programs, they can, the regional centers can pay for it if the individual chooses or the family chooses to do so. So yes, that's on our radar.
So you said that within a month, you guys are going to open something right here in this building, right? And then several locations in the Bay Area. That is, if I understand it correctly, you're opening this up to consumers.
Yes.
So parents would come, they would pay, and the kid gets that experience.
The first visit is free, so they try it out, and if they like it, yes, they can pay and become a member. It's a membership model. But actually, you can see the machines today.
Yeah, would love to.
Yeah, right after this.
Spread the word within our community of parents and children.
Yes, definitely. Yes, sir.
Within your own research, did you have any mechanisms or any metrics that you tracked for all these different factors that what you saw empirically were improving?
No, because our first goal was safety and feasibility. We're a pre-seed stage company, so we are very early in this, and we wanted to make sure that, well, will they use the VR set? If they don't use, all bets are off, right? So we wanted to make sure that is possible. And will they do the exercise? Will they be able to play the game? And so those are the kinds of things we wanted to get out of the way first.
Okay, well, what is your plan for the future? Let's say they love it, they use it for 3 months. You have all that data research. Would you go to next steps and say we can make it harder, we can implement some educational angle into the game, or help them to learn or advance?
Yeah, very, very good question. So our first goal is to fine-tune the protocols, right? Which games, which machine, what type of individual will fit which program. So fine-tune that program, and then be able to collect all the data that is needed to be able to make those decisions. So once we have that, then we know, okay, which means machines are working for which individuals, which program. Once we know that, then we'll go and expand to bigger centers. Right now, we are just an R&D center here, but we will take individuals who want to come join and use the service. But our next center is probably going to be in Pleasanton area because there's a lot of need there, and then that's going to be a much bigger center. And hopefully by the end of this year, we'll know.
Are you planning to franchise those?
Eventually, yeah. The initial goal is to set up at least 4 centers in the Bay Area, and then gather enough data, and then we'll do the clinical studies, and then that's where we look at, okay, what outcomes are improving based on our data so far, and then once we know, okay, this is very critical, and then we'll design a clinical study on that specific symptom, and with that specific machine, with that specific program. And so we have nice people here in the room who are, actually thinking about those things. So meet my team, and they have many more ideas than what I can come up with. All right, thank you very much, guys.